Today we're here to check blood glucose levels and to teach you, the nurse, exactly how you can check blood glucose levels. We have our equipment set up here and we're waiting for our patient to arrive. And that way we will teach you exact mechanism on how to check blood glucose, the proper technique. This is Teresa, our patient has arrived. Teresa, how are you doing today?
Fine, thank you.
You know, today we're going to demonstrate on this video for nurses exactly how to check blood glucose levels. And you've been a diabetic, the type 1 for
26 years.
26 years. So you don't mind us poking you in, doing this the proper way, and showing everybody exactly how to do it. We have a couple different machines here. We have the AccuCheck and the Freestyle. The first one we're going to show them exactly how to do blood glucose levels on their finger, and then the other we're going to use an alternative site. Is that okay with you?
Yes.
Okay. And for the purpose of this, I know you've cleaned your hands, but we're going to use a hand sanitizer wipe, and then I have a hand sanitizer here and gloves, and we'll go ahead and do this the proper way. Okay. Is there any questions that you have?
No.
Okay. I think this will be very good, especially for new nurses, to understand and learn exactly how to check their blood glucose levels. Have you ever found that, being a nurse yourself, have you ever found that sometimes people don't know exactly how to check blood glucose levels?
Yes.
Okay. So we'll go ahead and get started here. So I'll let you go ahead and use the wipe here on your own finger. I'll clean my hands with hand sanitizer. And I'll don gloves. And just make sure that you use gloves. You always have to protect yourself from bloodborne pathogens as well as the patient from you. So it's very important for you to don gloves and make sure that you use all proper techniques. We're going to load the Lancing device. And this is a Lancing device here that we'll use. And then we'll prepare this by cocking it back, and we'll get our strip here. Just make sure to always check your strips and make sure that they have the correct date and they're not out of date. And make sure that they've been at least at room temperature and not above that. You can place your strip and then your meter will come on. And Teresa's already cleaned her finger. I will also get a 2x2 so that we can wipe our finger after. Although not required, it is a good practice to kind of rub, which finger was it? You can kind of rub the finger here and get it prepared to bleed. And what you do, you will use your lancing device and just warn the patient, we're going to go ahead and lance your finger, okay? And then we got our drop of blood. Although not required, it is a good idea to wipe off that first drop of blood. So in case there is any contaminant on the finger, you can wipe that off. The second drop of blood, you don't need a lot of blood with today's meters. You can go ahead and get this, and the meter's working. And what I always like to do is take that 2x2 and just hold pressure there while we're waiting for the number to come up. And Teresa's number was 106 today, which is excellent. And then Teresa stopped bleeding. If she hasn't stopped bleeding, you can use a Band-Aid. And we will reach for our sharps container, and then I'll put away I like to put away the biohazard there. Just so you know, when we prepare Teresa's finger, we prepared Teresa's finger so that we got off any bacteria. Because what we don't want to do is cause the patient any type of infection, especially when you're in an institution. It's a good idea, as I said, to either wash the hands with soap and water. You can use some kind of a disinfectant, hand sanitizer, or you can use a nice warm cloth, especially if the patient can't get out of bed or they're bedridden. You can use a warm cloth. You can use alcohol as well. The problem with using alcohol in a long-term setting is that basically it can cause an issue with drying out of the skin, which increases the patient's chance for infection, so you don't want to do that. The lancing device, remember, lancing devices need to be either individual or they need to be disposable. You must make sure that you never reuse a lancing device for the same patient or cross-contaminate the lancing device and use the same lancing device for another. So it needs to be individualized, where you should have the patient's name, room number, change the lancet for each patient every time, even if it is their own personal lancet. You should change that lancet each time. And as I said, it should be personalized, or use a disposable lancing device. we chose the side of the finger. You must choose the side of the finger or the top of the finger. Remember the side of the fingers, either side of the finger or the top of the finger. Never use the center of the finger or the pad, because this is where the nerve endings are, and it's very painful for the patient. You'll get a much larger drop of blood either on the side or at the tip. I don't prefer the tips, and we don't use the thumbs. And you should rotate your fingers so that the patient does not end up with sore fingers. Is that correct, Teresa?
Yes.
Do you rotate your sites all the time?
All the time.
So Teresa rotates her sites all the time. And remember, when we're doing blood glucose testing, there's a reason. And Teresa, I always tell people that there's a reason we check blood glucose. One is it keeps you in compliance with what your physician wants you to have, as well as you understanding exactly what your symptoms are. But sometimes I always say that checking blood glucose levels is choice and consequence. Sometimes choice of what you've eaten in carbohydrates, and the consequence really is at the tip of your finger in milligrams per deciliter. Remember, we measure blood glucose here in the United States in milligrams per deciliter. So with that, it's sometimes you have to understand on the patient's hydration level as well. If somebody is dehydrated, then their blood sugar might actually look to be much higher than it really is. And once you rehydrate them, that actually may come down. So you need to keep your patients, especially diabetic patients, well hydrated. Is there anything else, Teresa, you have any questions about?
No.
Okay, well, I think we did that. I would like to also show them exactly what alternative site testing is. Alternative site testing, just for you to be aware, isn't usually used in hospitals or long-term care settings. However, if they're in an outpatient, you might do it. Patients might need to know how to do it. So sometimes you have to know exactly how to teach patients to do their own blood glucose levels, especially self-monitoring blood glucose levels. I'll include some of the links so that you can look up exactly what it means to check blood glucose levels, some of the exact mechanisms in which to do that as well as some of the alternative sites. Some of the alternative sites that you can use: the palm of the hands, the arm, the forearm. You can use the leg. You can use the thigh. I would prefer, especially in type 2 patients, that you really stick with the arms. In a type 2 patient, you probably do not want to use the legs. If you do, it should be the upper thigh. I'd probably stay away from the lower extremities if possible. Alternative site testing should never be used after someone has exercised or is quite diaphoretic, or if they have, or if you suspect that they have hypoglycemia. So if they have hypoglycemia, I would not use alternative site testing. I would use the fingers. So we're going to go ahead and use an alternative site. And Teresa, where would you like your alternative site to be?
My forearm.
We'll use Teresa's forearm. And remember, I told you we will change lancing devices each time. So we're going to use the new lancet. And you need to stay away from moles, scars, veins, or any other lesion that might be on the person's arm, especially for alternative site testing. And so what we'll do is switch to our alternative site machine. Not all machines can be alternative site machines. So we're going to use the Freestyle, which actually has alternative site testing. And go ahead and load this. So we're going to choose, Teresa chose an alternative site, so we're going to go ahead and clean her alternative site, which is her forearm, with the alcohol prep. Go ahead and use that. Okay. We'll let that thoroughly dry. Remember, no matter where you check the blood glucose levels, you need to make sure that you have the site thoroughly dry before you do check the glucose. And that is dry at this point. We will go ahead and get this alternative site. Here we go, Teresa. We have our drop of blood here. Get it here. Then we'll go ahead and write the site with the 2x2 and hold pressure. And Teresa's blood sugar is 106. It's kind of funny that we got the exact same blood glucose levels, but remember, sometimes you can have a difference depending on the machines you use. But Teresa's was exactly where we are. Teresa, how was that alternative site testing?
It was okay.
So for the purpose here, we'll just go ahead and get rid of this stuff in our sharps container. And then remember, I told you that you needed to get rid of your sharp. And you need to be cautious because there is a potential for blood-borne pathogens to pass on to you or someone else's. So you need to make sure that you take your sharps and make sure that they go in the sharps container and get rid of all your biohazards. So we'll go ahead and get those. I'll pull the gloves out. And I'll put this in a biohazard bag in a few minutes. Hands. Teresa, do you have any questions on what we have done?
No.
And do you prefer alternative site testing or do you prefer fingers?
Fingers.
And what do you see mostly in the hospital?
Fingers.
So in the hospital, it's pretty much standard that finger testing is alternative site testing. I think we've seen it more in children as well as outpatients. So just remember that there are different sites that you can use, but mostly for what nurses are going to need to know, especially looking for either hyper or hypoglycemia in a hospital, you're going to need to use your fingertips. So if there's any questions, please direct those to us. And just remember that you need to ensure that your patients know how to check their blood glucose levels and that you do it correct and proper each time. And just be cautious and make sure that the patient's always comfortable. Have a great day.